Let's talk about Neyman bias or late look bias. So why it is called Neyman? Because Neyman was a statistician who first described this bias. And this Neyman bias is also called late look bias. Late look. So you are looking late. So the word itself tells you are looking late. I actually do not like the eponyms, the name in these types of terminology, because this does not tell you anything. Like Neyman bias. What is Neyman bias? You cannot guess, right? Unless you have some memory. But when you hear the term late look bias, you can guess. There is some thing that is occurring late. You are looking in the condition in late stage. So this tells you what it can be, right? You can guess it. But definitely we have to honor who first described it, because before Neyman no one was able to consider it. Unless you already know, you cannot look at anything. This is a common thing, that unless you have some memory related to something, we cannot understand new thing, right? Unless you are really intellectual like Neyman or scientists. So they think from different perspective, they try to invent, so those people catch new things. But we, or I cannot say we, but I am a clinician. I work in a hospital, and how I treat patients, how I reach to diagnosis, that I have memorized certain diagnoses, certain algorithms in my neurons in the head, and I compare the patient's symptoms to that algorithm and try to match it, right? Definitely if there is some new diagnosis that I have never read about, I cannot diagnose it. I will miss it, or I will make it another diagnosis, because I have never heard about diagnosis. I have never read about the diagnosis, because we are just what we do, we are comparing the new information to past information, and we try to match our diagnosis, right? But those people who are scientific, who have scientific neurons in their head, like scientists like Neyman, think from different perspective. So let's now come to Neyman bias or late look bias. So what it actually means. So I want to give you one example. Let's say you want to estimate the prevalence of heart attack in your community, and in your community there are 5 or 6 hospitals. You went to all hospitals and you noted all the prevalence of heart attack, right? And you calculated one prevalence. And you found that prevalence is low. But you have read that in your state, in your country, there is high incidence of heart attack these days. So what might have occurred here? One thing is that you are looking in the late stage of the disease. Patient who had heart attack, there is chance of having ventricular arrhythmia in the early stage, and patient might have died at home and never reached to the hospital. I have one problem. I do not word some words fully, and that might impact the interpretation you made now. But now I try to speak word fully. So they might not reach to the hospital, they might have died at the home. So in fact there is high prevalence of the heart attack in your community, but since you are missing the early stage of the disease, you estimated that the prevalence of heart attack is low in your community, right? So you are looking late in the stage of the disease. That's why it is called late look bias. Let's take another example, like you are estimating some prevalence of lung cancer, and you estimated the prevalence of lung cancer in a hospital, in your hospital where you are working, and you found a certain prevalence, and you published your study that prevalence of lung cancer in my state is this much. But what might have occurred here? Those patients who had aggressive lung cancer might have died earlier, right? Or they might have not seek treatment because they knew that this disease is not curable. They may have some perceived notion or whatever. So you are not taking into account the whole picture. You are just taking into account one part. Whatever the cases is admitted in your hospital, the cases of lung cancer, you did not take into account who had aggressive lung cancer who died. So there is a bias is occurring, right? So this is called late look bias.